Seniors, you're taking vitamin B12 the wrong way, doctor reveals. If you are a senior, specifically over the age of 60, and you diligently incorporate vitamin B12 into your daily regimen, a moment of profound reflection and careful attention is absolutely crucial right now. This isn't just a casual piece of advice, it's a vital imperative that could significantly impact your ongoing health and well-being. The issue at hand transcends mere compliance with a daily supplement schedule. It delves into the intricate mechanisms of absorption and utilization, particularly as the human body gracefully yet complexly ages. In my clinical practice, a recurring query echoes through the consultation room almost every single week, revealing a widespread misunderstanding about this essential nutrient. Patients, often with a sense of frustrated resignation, pose questions such as, "Doctor, I take my B12 supplement with unwavering faithfulness, ensuring I never miss a dose. Yet, despite my dedication, why do I continue to grapple with persistent fatigue that saps my energy, an unsettling brain fog that clouds my thoughts, dizzy spells that disrupt my balance, or that unsettling numbness and tingling sensation in my hands and feet?" These are not isolated complaints, but rather a pervasive pattern that highlights a significant gap in understanding regarding vitamin B12 efficacy in older adults. A recent encounter with a 68-year-old patient perfectly encapsulated this perplexing dilemma. This gentleman, with a diligent approach to his health, had been consistently taking vitamin B12 supplements for an extended period, spanning more than 7 years. His blood tests, which are typically considered the gold standard for evaluating nutrient levels, consistently returned results that were technically classified as normal. However, despite these seemingly reassuring lab numbers, his personal experience painted a starkly different picture. His overall energy levels were undeniably on a steady decline, a concerning trend that impacted his daily activities. Furthermore, his sense of balance had noticeably deteriorated, leading to increased apprehension about falls, and perhaps most distressing for him, his memory was unequivocally worsening, manifesting as frequent lapses and a general fogginess that interfered with his cognitive clarity. What truly astonished and frankly bewildered him was the revelation that followed our in-depth discussion and reevaluation. It wasn't that he was suffering from a deficiency of vitamin B12 in the traditional sense. His body wasn't entirely devoid of it. The profound issue, which countless others unknowingly share, was that he was consuming the vitamin B12 in a manner that rendered it largely ineffective for his specific physiological needs as an older adult. He was, in essence, taking it the wrong way, preventing its vital absorption and utilization where it mattered most, within his cells and nervous system. Emerging and increasingly robust scientific research is shedding critical light on this widespread problem, indicating that one very common mistake in B12 supplementation, particularly prevalent among adults aged 60 and above, can act as a silent but formidable barrier. This mistake effectively blocks the proper absorption of B12, leading to an insidious and often unrecognized damage to crucial nerve function. As Dr. Emily Carter, I am committed to disseminating this vital knowledge. In this comprehensive explanation, I aim to meticulously dissect that fundamental mistake, elucidate why this critical nuance is so frequently overlooked by even experienced medical professionals, and most importantly, provide precise, actionable guidance on how to optimize your vitamin B12 intake. The goal is to ensure it genuinely supports the intricate health of your brain, fortifies your entire nervous system, and provides sustained, long-term energy, allowing you to thrive in your later years. Before we delve into the intricate details, I encourage you to share your age and current location in the comments below. Furthermore, if you are currently taking B12 but still find yourself battling persistent fatigue, frustrating brain fog, or disquieting numbness, please articulate your experiences. Your insights are invaluable, contributing significantly to the collective knowledge and support of our entire community. And if you find this information resonates with you, I urge you to hit that subscribe button, as I consistently share potentially life-saving health strategies specifically tailored to help you flourish robustly after 60. The prevailing belief among many, including numerous healthcare providers, is that if a standard blood test indicates a normal B12 level, then everything related to this vitamin must be perfectly in order. However, this assumption, particularly for adults aged 60 and beyond, is regrettably and often profoundly incorrect. Vitamin B12 is not just another nutrient. It is an indispensable powerhouse, absolutely essential for the robust functioning of your nerves, the intricate health of your brain, the vital production of red blood cells, and the efficient metabolism of energy throughout your body. Without an adequate supply of usable B12, not merely present B12, the delicate machinery of your nerves begins to malfunction, much like an electrical system with insufficient power. This critical deficit is precisely why the early manifestations of B12 insufficiency often include unsettling, tingling sensations in the hands and feet, insidious problems with balance that can increase the risk of falls, pervasive and inexplicable fatigue, frustrating memory lapses that hinder daily life, and the aforementioned persistent brain fog that dims cognitive clarity. Herein lies a significant and often overlooked aspect of aging. As we advance in years, a fundamental physiological change occurs that sharply diminishes our body's inherent ability to absorb vitamin B12 effectively. By the time individuals reach the age of 60, a staggering proportion, more than half of all adults, experience a noticeable reduction in stomach acid production. This decline is not merely an inconvenience. Stomach acid plays an absolutely indispensable role in the initial stages of B12 absorption. It is critically required to separate vitamin B12 from the complex food matrices and the binding proteins found in supplements. Without a sufficient quantity of this crucial gastric acid, the B12, whether derived from food or a supplement, largely bypasses the body's absorptive mechanisms, passing through the digestive system unused and unutilized, rendering it essentially inert. I witnessed this phenomenon with striking clarity through the case of one of my patients, Margaret, who was 71 years old. Margaret presented with a distressing constellation of symptoms, primarily complaining of burning sensations in her feet that made walking uncomfortable and frequent bouts of dizziness that severely impacted her confidence and mobility. Her primary care physician, following standard protocol, checked her B12 level. The result came back at 420 picograms per milliliter, a figure technically falling within the normal reference range for most laboratories. Based on this number, she was reassuringly informed that nothing was wrong. And yet, Margaret's debilitating symptoms relentlessly continued to progress, growing more intense and frequent, profoundly impacting her quality of life, despite the supposed normalcy of her lab results. What most individuals, and even many clinicians, fail to grasp is a fundamental distinction. A standard blood B12 test does not provide a true measure of how much B12 is actively entering and being utilized by your cells. It merely indicates the concentration of B12 that is circulating freely within your bloodstream. In the context of older adults, it is entirely possible, and indeed quite common, for B12 levels to appear within the normal range in a blood test, while simultaneously the vital nerve cells throughout the body are literally starving for this essential nutrient, unable to access or properly utilize it. This critical disconnect is precisely why so many seniors conscientiously take B12 supplements for years on end, often expending considerable financial resources, yet report absolutely no discernible improvement in their debilitating symptoms. Their bodies are receiving the vitamin, but not truly benefiting from it. Now, let us illuminate where the first major and pervasive mistake in B12 supplementation typically occurs, impacting countless seniors. The vast majority of older adults, when advised to take vitamin B12, typically consume it in the form of a standard oral tablet, which they then swallow with a glass of water, assuming it will be absorbed in the same straightforward manner as any other vitamin or nutrient. However, for individuals over the age of 60, this conventional delivery method is frequently and profoundly ineffective, often failing to deliver the promised benefits. The intricate process of vitamin B12 absorption requires the active participation of a specialized protein known as intrinsic factor, which is produced specifically in the stomach. As we age, a natural and largely unavoidable physiological decline in the production of intrinsic factor commonly occurs. Without an adequate supply of this critical protein, orally swallowed B12 tablets are very poorly absorbed through the digestive tract. This isn't an uncommon or rare anomaly. It is an extremely prevalent challenge faced by a significant proportion of the senior population. The 68-year-old patient I referenced earlier, whose declining energy, balance issues, and memory lapses were so perplexing, had been taking his B12 exactly as prescribed, the same dose, the same brand, consistently every morning. Yet, despite his strict adherence, the health and function of his nerves were demonstrably and steadily deteriorating. It was only when we made a crucial modification, altering the form of B12 he was taking, rather than simply increasing the dose, that his debilitating symptoms began to noticeably improve within a matter of weeks, underscoring the profound importance of the delivery method. This fundamental insight illustrates why the specific form of vitamin B12 is just as, if not more, critical than the sheer amount being consumed, especially for older adults. If you are finding this detailed explanation helpful and insightful, please take a moment to hit that like button. Your support genuinely aids the channel in reaching and educating a wider audience of seniors who desperately need this vital information to reclaim their health. Moving beyond the delivery method, let us now meticulously examine the second prevalent mistake, one that is also alarmingly widespread and often deeply ingrained in people's supplement choices. This common error involves individuals inadvertently taking the wrong form of B12 altogether. A cursory glance at the labels of most B12 supplements lining the shelves of pharmacies and health food stores will invariably reveal one particular name appearing with overwhelming frequency: cyanocobalamin. While cyanocobalamin possesses several characteristics that make it attractive to manufacturers, it is inexpensive to produce, highly stable, and boasts a long shelf life. It is, unfortunately, the least effective and bioavailable form of B12 for the physiological needs of older adults. Cyanocobalamin is, by its very nature, a synthetic derivative of vitamin B12. This means that upon ingestion, your body cannot immediately utilize it in its current form. Instead, it must undergo a multi-step metabolic conversion process to transform it into the biologically active forms of B12 before it can effectively participate in vital cellular functions. This conversion pathway is not trivial. It necessitates robust liver function, optimal activity of specific enzymes, and an adequate reserve of antioxidant capacity within the body. In adults over the age of 60, these complex biochemical processes, which are often taken for granted in younger individuals, frequently experience a considerable slowdown, compromising the body's ability to efficiently convert cyanocobalamin into its usable forms. I observed the tangible effects of this metabolic inefficiency in another patient, Robert, who was 72 years old. Robert had been taking cyanocobalamin diligently for many years, trusting it to support his health. While his blood levels, much like Margaret's, appeared acceptable on paper, he continued to endure persistent numbness in his fingers, a symptom that deeply affected his dexterity and fine motor skills, and experienced significant difficulty walking, which severely limited his independence and mobility. The moment we implemented a crucial change, switching him to methylcobalamin, which is an intrinsically active form of B12, readily available for the body's immediate use, the transformation was nothing short of remarkable. Within just 1 month, his balance showed significant improvement, a critical factor in preventing falls and enhancing his confidence. By the 3-month mark, the debilitating numbness in his fingers had decreased significantly, restoring a greater sense of touch and function. This observation is strongly corroborated by extensive research, which unequivocally demonstrates that active forms of B12, such as methylcobalamin and adenosylcobalamin, are absorbed and utilized far more efficiently and effectively in older adults, bypassing the need for complex and often compromised conversion pathways. Beyond the form of B12, another critical yet frequently overlooked aspect is the timing and consistency of dosage. Many seniors, following generalized advice, simply take their B12 supplement once in the morning and assume that this single dose is sufficient to meet their body's continuous requirements. However, vitamin B12 is a water-soluble nutrient. This fundamental characteristic means that it is not stored extensively in the body. Rather, any excess amounts are relatively quickly cleared from the bloodstream and excreted. For individuals with existing absorption issues, a single daily dose may simply not be enough to maintain sustained therapeutic levels necessary for ongoing nerve repair and optimal cellular function throughout the entire day. The body needs a consistent supply, not just a fleeting peak. Furthermore, there exists a dangerous and widespread misunderstanding surrounding B12 injections. Some individuals, particularly those who have struggled with oral supplements, mistakenly believe that B12 injections represent the only viable solution for ensuring adequate levels. While injections are undeniably potent and exceptionally helpful in cases of severe clinically diagnosed B12 deficiency, they are not always the necessary or sole recourse. In reality, high-quality sublingual B12 formulations, when taken correctly and consistently, can be just as remarkably effective for a vast majority of seniors. Sublingual forms of B12, designed to dissolve under the tongue, possess a distinct advantage. They bypass the complex and often compromised digestive environment of the stomach and the dependency on intrinsic factor. This unique delivery mechanism allows for direct absorption of the vitamin through the rich network of blood vessels in the oral tissues, delivering B12 directly into the bloodstream. This method is particularly vital and advantageous for older adults who typically experience reduced stomach acid production or grapple with other chronic digestive issues that hinder conventional oral absorption. The overarching and crucial lesson to internalize here is elegantly simple. If you are over 60, merely swallowing a standard B12 tablet might yield technically normal lab numbers, creating a false sense of security, but it may very well be failing to genuinely protect and nourish your precious nerves. Now we arrive at the third significant mistake, one that often catches most seniors completely by surprise because it has absolutely nothing to do with the dose of B12 or its specific form. Instead, this critical error revolves around the fundamental principles of timing and consistency in supplementation. Many individuals approach vitamin B12 as if it were an as-needed remedy, taking it only intermittently when they experience noticeable symptoms such as profound fatigue. This leads to a pattern of skipping days, discontinuing the supplement entirely when symptoms show a fleeting improvement, and then belatedly restarting weeks later when symptoms inevitably resurface. This fragmented approach fundamentally misunderstands the body's physiological requirements for nerve tissue repair. Vitamin B12 is not akin to a stimulant that provides an immediate transient energy boost. Rather, it functions as a crucial repair nutrient. Your delicate and complex nervous system demands a steady, uninterrupted, and daily availability of B12 to embark upon and sustain the intricate process of rebuilding damaged myelin, the vital protective coating that insulates nerve fibers, much like insulation around an electrical wire. This myelin sheath is essential for efficient nerve signal transmission. Intermittent or inconsistent dosing of B12 tragically interrupts this slow, methodical, and continuous repair process, effectively halting progress just as it begins to take hold. I distinctly recall observing this detrimental pattern in Elaine, a 70-year-old patient who diligently took her B12 only on days when she felt utterly exhausted. On those particular days, she might report feeling a slight transient improvement in her energy, but her chronic numbness, her persistent balance issues, and her troubling memory problems remained stubbornly unimproved, showing no signs of lasting resolution. supplementation. It was only when she adopted a consistent, unwavering daily regimen of B12 supplementation without any skipped doses that her symptoms began to visibly stabilize. After 2 months of this steady intake, the progression of her tingling sensations halted. After 4 months, her balance, which had been a significant concern, showed a discernible improvement, providing her with greater confidence and reducing her risk of falls. Another often overlooked aspect of B12 supplementation, intimately tied to timing, is the time of day it is consumed. Many seniors, perhaps unaware of its potential impact, take B12 late in the evening or just before bedtime. For a significant number of individuals, this practice can inadvertently interfere with the natural sleep cycle. B12, being involved in energy metabolism, can sometimes impart a subtle sense of alertness, which is counterproductive when trying to initiate sleep. Poor quality sleep, in turn, is not a benign issue. It actively elevates cortisol levels, the stress hormone, significantly increases systemic inflammation throughout the body, and critically slows down the already intricate and lengthy process of nerve repair. Therefore, for the vast majority of seniors, the optimal time to take B12 is earlier in the day, ideally in the morning or early afternoon. This strategic timing ensures it supports daytime energy levels and nerve function without the undesirable side effect of disrupting precious nighttime sleep, thereby allowing the body to optimize its restorative processes. Beyond supplementation, adequate hydration also holds more significance than most people realize in the context of B12 efficacy. Vitamin B12 exerts its vital effects inside your cells, and these cells are utterly dependent on a proper fluid balance for their optimal functioning. Chronic mild dehydration, a remarkably common condition among older adults due to reduced thirst sensation and other factors, severely impedes the efficient transport of crucial nutrients, including B12, into the delicate nerve tissue where they are most needed. If you are conscientiously taking B12 supplements but rarely ensure sufficient water intake throughout the day, the potential benefits and the ultimate results of your supplementation efforts will be considerably limited. Hydration is not just a general health recommendation, it is a direct facilitator of B12's cellular action. Finally, and critically, many seniors are simultaneously taking various prescription medications that can directly or indirectly interfere with the absorption or proper function of vitamin B12 within the body. These often include commonly prescribed drugs such as acid blockers, e.g., proton pump inhibitors or H2 blockers used for heartburn, metformin, a widely used medication for type 2 diabetes, and certain classes of antibiotics. This important revelation does not, under any circumstances, imply that you should abruptly cease taking your prescribed medications. Instead, it signifies that you must engage in an informed discussion with your healthcare provider to collaboratively adjust how you effectively support and maintain your B12 levels, potentially through modified forms, increased dosages, or alternative delivery methods to counteract these known pharmacological interferences. By this point, a crucial and perhaps eye-opening realization should be dawning upon you. Most seniors who are experiencing persistent B12-related symptoms despite supplementation are not merely making one isolated error in their approach. Far more commonly, they are inadvertently committing several small, seemingly innocuous mistakes concurrently. Each individual mistake, when viewed in isolation, might only slightly diminish the overall benefit of the vitamin. However, when these multiple errors accumulate and interact synergistically, their combined effect can be profound, often completely canceling out the intended positive impact of vitamin B12, leaving individuals feeling frustrated and without improvement. It's a cascading effect, where the sum of the minor errors leads to a complete failure of the therapeutic goal. Now, with a clear understanding of these common pitfalls, allow me to meticulously guide you through the correct and highly effective vitamin B12 protocol specifically designed for seniors. This is the evidence-based approach that I rigorously implement and recommend to my own patients over the age of 60, an approach that prioritizes physiological realities over generalized recommendations. First, let us revisit the critical aspect of the form of B12. For the vast majority of seniors, the superior choices are methylcobalamin, or even more robustly, a synergistic combination of methylcobalamin and adenosylcobalamin. These are the active coenzyme forms of B12. This means that your body can immediately put them to use without the need for any complex, energy-intensive, and often compromised metabolic conversion steps. Therefore, it is imperative to consciously avoid relying solely on cyanocobalamin, especially if you are currently experiencing any neurological symptoms such as tingling, numbness, or cognitive fogginess, as its bioavailability in older adults is significantly diminished. Second, the delivery method is paramount. If you are over the age of 60, simply swallowing a standard B12 tablet is, more often than not, insufficient for optimal absorption and utilization. The recommended alternative, which dramatically circumvents many of the common absorption challenges, is sublingual B12. This involves placing the tablet or liquid drops under the tongue and allowing it to dissolve slowly and thoroughly. This method ingeniously bypasses the need for stomach acid and intrinsic factor, allowing for direct absorption through the highly vascularized oral mucosa into the bloodstream. Implementing this single change alone can lead to a dramatic improvement in clinical outcomes and symptom resolution. Third, let us address dosage. For effective nerve and brain support in the senior population, the notion of low doses often proves to be woefully inadequate. Most older adults require significantly higher amounts of B12 to effectively overcome the various absorption barriers and to achieve therapeutic tissue levels. A widely accepted and generally effective daily dosage range typically falls between 1,000 to 2,000 micrograms. It's not uncommon for some individuals to require an even higher initial dose to replenish severely depleted stores, followed by a slightly lower, consistent maintenance dose once symptoms improve. This higher dosage is generally not associated with danger. Vitamin B12 is water-soluble, meaning that any excess amounts are safely and naturally excreted by the body, minimizing the risk of toxicity. Fourth, consistency is non-negotiable. Vitamin B12 must be taken diligently every single day. It is not a supplement to be taken occasionally, nor should it be reserved only for days when you feel particularly tired. The process of nerve repair and regeneration is inherently slow and continuous. Symptoms often improve gradually over a period of weeks to several months, rather than producing immediate overnight transformations. Intermittent dosing will only hinder this vital, ongoing restorative process. Fifth, consider the timing of your daily dose. For the majority of seniors, the most beneficial time to take B12 is in the morning or early afternoon. This strategic timing aligns with the body's natural diurnal rhythm, supporting daytime energy levels and optimizing nerve function without creating the undesirable side effect of sleep disruption. If you find that B12 tends to make you feel noticeably more alert or energized, it is particularly advisable to avoid taking it late in the evening. Sixth, remember the crucial role of supportive nutrients. Vitamin B12 does not function in isolation. It is part of a complex biochemical symphony. For comprehensive nerve support, other B vitamins, particularly folate, vitamin B9, and vitamin B6, are frequently necessary. However, a word of caution is warranted regarding high-dose folic acid, the synthetic form of folate. Natural folate, or its methylated active form, known as methylfolate, is generally much better tolerated and more bioavailable, especially in individuals with certain genetic variations that impair folic acid conversion. Always consult with a healthcare professional before adding high doses of other B vitamins. Seventh, monitoring progress should extend beyond mere lab numbers. While blood tests provide valuable baseline data, do not judge the success of your B12 protocol solely on these figures. Instead, pay keen attention to the tangible improvement in your symptoms and overall quality of life. Are the numbness or tingling sensations in your hands and feet becoming less frequent or intense? Is your balance perceptibly improving, instilling greater confidence in your gait? Is your thinking clearer, and are those frustrating memory lapses becoming less common? These subjective yet profoundly meaningful changes in your daily experience matter infinitely more than a single numerical value on a laboratory report. I recall a patient, a 75-year-old woman, who meticulously adhered to this precise protocol. After 3 months, her laboratory values showed only a slight, almost negligible alteration. Yet, her ability to walk had markedly improved. Her concerning falls had ceased entirely, and, perhaps most importantly, her confidence in her own body had triumphantly returned. That, unequivocally, is the true measure of success. At this juncture, it is absolutely vital to grasp one critical and overarching truth. While vitamin B12 is an incredibly powerful and essential nutrient, it is not, by any stretch of the imagination, a magical cure-all. There are specific and important situations where B12 supplementation alone, even when administered correctly, will not fully or entirely resolve all symptoms. Understanding these limitations is as crucial as understanding its benefits. One of the most common complicating issues is the presence of long-standing nerve damage. If nerve compression, such as from a pinched nerve, spinal degeneration, or complications arising from diabetes have been present and causing damage for many years, B12 can certainly provide invaluable support for ongoing repair processes and mitigate further deterioration. However, it cannot realistically be expected to reverse severe, long-established structural damage overnight, or sometimes even fully. The body's capacity for repair, while remarkable, has its limits, especially when damage has accumulated over an extended period. Another frequently overlooked factor that can impede B12's effectiveness is inadequate blood sugar control. Chronically elevated blood sugar levels directly and perniciously damage nerves throughout the body, a condition known as diabetic neuropathy. In seniors living with prediabetes or established diabetes, nerve-related symptoms such as numbness and tingling may stubbornly persist or even worsen, irrespective of B12 intake, unless and until their glucose levels are effectively and consistently managed. Addressing blood sugar is a fundamental prerequisite for nerve health. Systemic inflammation constitutes another silent and insidious blocker. Chronic, low-grade inflammation interferes significantly with optimal nerve signaling and severely compromises the efficient delivery of vital nutrients, including B12, to the nerve cells. Factors such as persistent poor sleep, chronic psychological stress, and predominantly sedentary lifestyle habits all contribute to elevated inflammatory markers throughout the body. If these underlying inflammatory drivers are ignored and left unaddressed, B12 is forced to work against a constant biological headwind, thereby delivering substantially less benefit than it otherwise could. It's like trying to fill a bucket with holes in it. Finally, there is the ever-present issue of misdiagnosis. It is imperative to remember that not all instances of numbness, tingling, weakness, or balance problems are exclusively caused by vitamin B12 deficiency. A range of other medical conditions can meticulously mimic B12-related symptoms, leading to diagnostic confusion. Conditions such as cervical spine compression, a pinched nerve in the neck, carpal tunnel syndrome, compression of a nerve in the wrist, or peripheral neuropathy stemming from entirely different underlying causes, e.g., certain autoimmune diseases, toxic exposures, or other metabolic disorders, can present with identical or very similar neurological manifestations. This underscores precisely why persistent or worsening symptoms should always be thoroughly evaluated by a qualified medical professional. Self-diagnosis and the assumption that simply taking more supplements will miraculously solve everything can lead to dangerous delays in identifying and treating the true underlying condition. Let me illustrate this with a quick but profoundly important example. A 73-year-old man presented to my clinic expressing deep frustration. He had, on his own initiative and after reading online advice, doubled his daily B12 dose, earnestly hoping for improvement. Despite this aggressive increase, his symptoms showed no signs of abating. Further, comprehensive evaluation, which included advanced imaging, ultimately revealed a diagnosis of spinal stenosis, a narrowing of the spinal canal that was physically compressing his nerves. In such a scenario, no amount of supplemental B12, regardless of its form or dose, could possibly rectify a mechanical compression of nerve tissue. Once the correct diagnosis was established and appropriate, targeted medical and physical therapy treatments were initiated to address the spinal stenosis. His B12 supplementation then became genuinely supportive of his overall nerve health and recovery, transforming from a source of disappointment into a valuable component of his comprehensive care. Now, let us meticulously bring all these crucial insights together into a clear, actionable, and empowering plan. If you are an individual over the age of 60 and you are currently taking vitamin B12, this concise summary outlines what truly matters most for your health and well-being. First, fundamentally shift your focus away from solely scrutinizing lab numbers. A technically normal B12 blood level, while reassuring on paper, does not unequivocally guarantee the robust health of your nerves or optimal brain function, especially as you age. Instead, cultivate a heightened awareness of how you feel on a day-to-day basis and diligently monitor how your body genuinely responds to your B12 protocol over a sustained period. Your subjective experience is a powerful indicator. Second, ensure you are utilizing the right form of B12. Make the informed choice to select an active, bioavailable form such as methylcobalamin, or, for a more comprehensive approach, a combination of methylcobalamin and adenosylcobalamin. These superior forms do not require the body to perform complex conversion processes and are, therefore, significantly more effective and better utilized in the unique physiology of older adults. Third, select the right delivery method. For those over 60, simply relying on conventionally swallowed tablets is often an ineffective strategy. Embrace sublingual B12, which is designed to dissolve conveniently under the tongue. This method ingeniously circumvents the common age-related challenges of reduced stomach acid and diminished intrinsic factor production, ensuring more reliable and direct absorption into your bloodstream. Fourth, commit to an effective dose. For the majority of seniors, a starting daily range of 1,000 to 2,000 micrograms is generally considered reasonable and efficacious. Remember, some individuals may require a higher initial loading dose to replete depleted stores, followed by a slightly reduced dose for ongoing maintenance. Always collaborate with your trusted doctor or healthcare provider if you have any uncertainties regarding the most appropriate dosage for your specific needs. Fifth, embrace consistency as a cardinal rule. Take your B12 every single day without fail. The intricate process of nerve repair and regeneration is inherently slow, demanding a steady and uninterrupted supply of this vital nutrient. Skipping doses will inevitably disrupt this crucial progress and hinder your recovery. Sixth, optimize the timing of your intake. For most individuals, taking B12 in the morning or early afternoon yields the best results, supporting daytime energy and cognitive function. If you find that B12 tends to enhance your alertness, make a conscious effort to avoid taking it late in the evening to prevent any potential disruption to your sleep patterns. Seventh, actively support the process through complementary lifestyle practices. Prioritize adequate hydration throughout the day. Diligently manage your blood sugar levels, especially if you have prediabetes or diabetes. Proactively address and improve your sleep quality and develop effective strategies for managing chronic stress. These multifaceted factors are not peripheral. They fundamentally determine whether the B12 you are taking can actually reach and effectively nourish your nerves and brain. Eighth, cultivate the wisdom to know when to look deeper. If your symptoms continue to worsen despite diligently following a correct B12 protocol, do not automatically assume that B12 alone is the sole or complete answer. Seek a proper and thorough medical evaluation to rule out other underlying causes, such as nerve compression, other metabolic issues, or different neurological conditions that may be mimicking B12 deficiency symptoms. I want to be unequivocally clear about this crucial message. Vitamin B12, when taken in the correct manner and under appropriate guidance, possesses remarkable potential to protect delicate nerves, support and enhance memory function, and significantly improve overall energy levels in a great many seniors. Conversely, when it is taken in the wrong manner, it can tragically appear to yield absolutely no benefit, leaving individuals disheartened and skeptical. The profound distinction between these two outcomes is not a matter of random luck or chance. It is fundamentally a matter of informed understanding and precise application of knowledge. Before we conclude this vital discussion, I wish to leave you with one final, deeply resonant thought. I recall a poignant case of a woman in her early 70s who came to see me, burdened by years of profound disappointment and a deeply ingrained belief that vitamin B12 simply did not work for her. After meticulously reviewing her existing B12 routine and habits, a striking pattern emerged. Nothing she was doing was technically wrong in terms of causing harm, but equally, nothing she was doing was being done correctly in a way that optimized absorption and utilization for her specific physiology. She was using the least effective synthetic form of B12, swallowing a tablet that her aging digestive system could not adequately absorb, taking it with debilitating inconsistency, and mistakenly judging its success solely by impersonal laboratory numbers. With simple but profound guidance, she made just a few targeted changes. She switched to an active form, adopted a sublingual delivery method, and embraced consistent daily intake. 3 months later, she recounted an experience to me that I will forever cherish. With a newfound sense of joy and relief, she exclaimed, "Doctor, I feel steady again. I actually trust my feet when I walk now, and I don't lose my words mid-sentence anymore. My thoughts flow freely." That, my dear friends, is the profound life-altering difference between merely taking a supplement and truly using it correctly for your body's optimal benefit. If you are over the age of 60, vitamin B12 is genuinely not an optional nutrient. It is an absolute necessity for sustaining your cognitive vitality, neurological health, and overall energy. However, how you choose to take it matters infinitely more than most people currently realize. I earnestly encourage each of you to critically examine your current B12 routine this very night. Ask yourself one simple yet profoundly important question. Is my current B12 protocol actually supporting and nourishing my precious nerves and brain, or am I merely checking a box on my daily health checklist without truly reaping its benefits? Before you depart, please take a moment to comment below with your age and current location. Share with our community what form of B12 you are presently taking, and crucially, what specific changes you are now planning to implement based on this detailed information. I personally read every single comment and deeply value hearing from our engaged and supportive community. If this comprehensive explanation has empowered you with a deeper understanding of an important aspect of your health, please consider sharing it generously with someone you care deeply about. It is highly probable that many seniors in your life are unknowingly taking vitamin B12 the wrong way and are simply unaware of the critical adjustments needed. Thank you sincerely for watching and for your commitment to your health. Please do not forget to hit that subscribe button for more life-changing health tips and strategies meticulously designed specifically for the unique needs of seniors. Remember, B12 is undeniably essential after 60, but its power is unleashed only if you take it correctly. I'm Dr. Emily Carter. Stay strong, stay healthy, and I eagerly look forward to seeing you in our next informative session.